Embassy bombing on Friday shared their challenges regarding medical compensation with Health CS Susan Nakhumicha, who in response stated that the Ministry of Health will next week form a multi-sectoral team to assess the compensation journey for the survivors. Elizabeth Atieno details.
It is in no doubt that the 1998 American embassy bombing completely transformed the lives of the over 5,000 innocent individuals caught up in the terror attack perpetrated by the Al-Qaeda group. The physical, emotional, and psychological torture experienced by these victims has forced them and their respective families to dig deep into their pockets to foot for their medical expenses for at least 25 years now.
My children have contributed and contributed. There was a time they had to deposit at a Karen hospital monthly 100,000 shillings.
On Friday, the survivors were granted yet another chance to present their epic medical compensation journey before the Senate ad hoc committee pushing for their compensation. Also present was Health Cabinet Secretary Susan Nakhumicha. In the coming week, the Ministry of Health will come up with a multi-sectorial team to assess the medical compensation for the survivors.
This will identify the vulnerable groups with limited ability to pay for their health care, who can be included in the National Health Insurance Fund, subsidized health insurance under the national scheme, and this can be done through the counties.
The survivors have also narrated on how they are unable to access some of the medication they need, which are at times unavailable in some health facilities, with those available being expensive.
This is what I use for my pain, back pain, because it's always paining. So I apply, and I have to wear a corset to hold the bones together.
And if all goes well, then the survivors will from November this year benefit from the Emergency Chronic and Critical Illness Fund, set to be launched together with the UHC rollout in a bill currently in Parliament.
With that fund, Madam Chair, it should be able to take care of anyone who is involved in an emergency and needs medical care.
I would request you kindly see what you can do at your level, and also speak to the President about these victims. These people have been suffering for the last 25 years.
For now, the survivors hold on to hope that the long and epic journey to compensation will come to an end once the Kavindu-led ad hoc committee holds a joint meeting with the American Senate in September this year. Elizabeth Atieno, TV 47, Nairobi.
Well, Sports CS